Welcome to the GAO Ask Dr. Kim channel. This video clip is for dentists. Let's learn dental implant treatment with GAO.
Hello everybody, I'm Dr. Kim, who's one of 5 Director of Global Academy of OSA Integration. Welcome to the GAO Ask Dr. Kim channel. I'm going to share a clinical case of implant remover and the replacement. This is how it looked when patient first came to my office, and actually this patient was referred from another dentist for removal of number 23 implant. As you see here, underneath of canine you can see the black shadow. Maybe it looks like a titanium dental implant, and you also can appreciate the scar on top of number 23. So it means previous dentist had a bone graft on number 23 area. This is from the occlusal view. From the panoramic view, I can notice the implant looks a little big, but the angulation looks like not too bad. Actually, it looks good, right? From the periapical view, the same. But after I took the CT scan, I was surprised because the implant was placed outside of the reach. There is only little amount of OSA integration in the palatal area, as you see here. Okay, but I noticed that this implant was placed 2-3 years ago, and it was under loading for a couple of years as well. But patient only had a complaint of a tenderness when he touches number 23 area. I explained the patient about the situation, and we decided to remove of dental implant. So after a couple of years, he showed up again, and I removed the implant crown with the abutment by making screw access hole on the lingual side of the number 23 implant. And I waited for 2 weeks to soft tissue heal on top of the implant. This is right before implant remover. And then I removed the implant, dental implant, with the instrument called implant remover kit from the Neobiotech. This is very useful gadget. So if you're dealing with the dental implant, I think you should have this one, because you don't know when you want to remove the implant. Someone, not only your implant, but also someone else placed implant. Okay, after the implant remover, I had a bone graft called bios collagen, which is a xenograft with the collagen matrix. And on top of bios collagen, I covered with the collar tape. During the procedure, and this was done like 14 December 30. Well, I should waited more, but patient came earlier because patient was living in the outside of Korea, and it was too early, I know, but I decided to place implant at that time after 2 months of the implant remover. Okay, this is how it look. So after initial drill, I took a periapical radiograph to see the angulation and the location of my drilling. So this is a picture right after the first osteotomy before implant placement. As you see here, there's a white particles, which is the bios collagen. It's not matured yet. So after I placed the implant, I cleaned up the bios collagen, and I decided to go for another bone graft. If you see number 24 and number 25, you can see the bony tubercles that I removed for the autogenous bone graft. So on top of the implant, I placed the autogenous bone, and on top of that, I placed the allogenic bone, which is FDBA. Then I covered with collagen membrane, and I closed up, right? Then after this is panoramic view after the implant placement. So I took another CT scan right after the implant placement and just right after the second surgery, uncovery of dental implant. So from the buccal point of view, you can see the grafted bone and the matured bone on the on number 23 area. So I temporize after a while. This is how it looks in the patient mouth. And this is my final restoration. I use a hybrid abutment, which is titanium and the titanium link and the zirconia core. And on top of that, I made a zirconia crown. So this is for during the trying. And this is how it looks. So at the same day, right after delivery of number 23 implant crown, that's how it looks. So from the panorama and the periapical view, you can notice the implant was well restored. Then the implant crown was placed 2015 in September, and the lower picture shows recent follow-up. So 2017 November and almost end of November. It stays there, and the patient was happy, and I'm happy too with the new implant restoration. Okay, we know implant is not trouble-free. So implant location from the beginning is very important, but that's what we already know. But don't worry, implant is a simple screw that we can replace. Better not, but we can do it. Okay, thank you for watching my very first YouTube clip. Okay, I'll be back with another case and another tutorial of instrument related dental implant. Thank you for watching, and bye bye. I'll be back.